The briefing took place on a Tuesday morning in September in the conference room of a humanitarian organization's Geneva office, where Ronaldo had come to learn about water infrastructure projects that his foundation might support. But what began as a routine discussion about clean water initiatives in various developing countries became something far more urgent and disturbing when the presentation shifted to conditions in Gaza, where water scarcity had reached crisis levels that threatened the survival of 2 million people whose access to clean drinking water had been systematically destroyed through policies that seemed designed to make normal life impossible for civilian populations who had no control over the political circumstances that determined whether they could access the most basic necessities required for human survival. The humanitarian worker leading the presentation was Dr. Sarah Mitchell, a water systems engineer who had spent 15 years working in conflict zones and disaster areas where water infrastructure had been damaged or destroyed. But her description of conditions in Gaza revealed something different from natural disasters or temporary disruptions caused by war, describing instead a systematic degradation of water systems that appeared deliberate and designed to create long-term suffering for civilian populations, rather than achieving any legitimate military objectives that might justify the collective punishment of entire communities, whose only crime was living in territory that was controlled by governments engaged in political disputes that ordinary people had no power to resolve or escape. The statistics that Dr. Mitchell presented were staggering in their implications for human health and survival, with over 90% of Gaza's water supply contaminated to levels that made it unsafe for human consumption, and the remaining sources of clean water controlled by authorities who could restrict access at will, creating conditions where children were drinking water that contained sewage, industrial chemicals, and salt water that caused diarrhea, kidney problems, and developmental delays that would affect their health for the rest of their lives if they survived childhood in an environment where basic sanitation and clean water were treated as privileges rather than fundamental human rights that should be guaranteed regardless of political circumstances or military conflicts that affected the territories where people lived. The technical details that followed revealed how water systems had been systematically targeted and destroyed, with treatment plants bombed, pipes severed, and electrical infrastructure disabled, in ways that prevented repairs and maintenance that would normally be routine aspects of municipal water management, and the blockade restrictions that prevented importation of replacement parts, chemicals needed for water treatment, and equipment necessary for drilling new wells or repairing existing infrastructure that had been damaged through military action or simple deterioration that could not be addressed when access to basic materials was restricted for political reasons that had nothing to do with water quality or public health concerns. Dr. Mitchell's explanation of the medical consequences was particularly disturbing, with detailed accounts of children suffering from preventable diseases caused by contaminated water, including cholera outbreaks that had killed dozens of people whose deaths could have been prevented with access to clean water and basic sanitation that were available in neighboring areas just kilometers away but were denied to Gaza residents through policies that treated water access as a political weapon rather than a basic human necessity that should transcend political disputes and military conflicts that affected civilian populations who needed water to survive regardless of their government's policies or actions. The photographs that accompanied the presentation showed children carrying plastic containers to collect water from sources that were obviously contaminated, families boiling water that was so polluted that boiling could not make it safe for consumption, and makeshift water treatment systems that people had constructed using whatever materials they could find, because proper equipment was not available due to restrictions that prevented importation of supplies that were essential for maintaining basic public health standards that should have been protected under international law that was supposed to guarantee civilian populations access to necessities required for survival, even during armed conflicts. Ronaldo's questions during the briefing revealed his growing understanding of how water scarcity was being used as a tool of collective punishment that affected entire populations, rather than just military targets. And his inquiry about what could be done to address the crisis led to Dr. Mitchell's explanation of the legal and political obstacles that prevented international organizations from providing adequate assistance, including restrictions on materials that could be imported, limitations on personnel who could enter Gaza to work on infrastructure projects, and political pressures that discouraged governments and organizations from addressing the crisis directly, because doing so might be interpreted as criticism of policies that were supported by powerful allies who preferred to maintain relationships rather than addressing humanitarian emergencies that required immediate action, regardless of political complications. The action plan that emerged from the briefing was both comprehensive and challenging, involving not just financial support for water projects, but advocacy for policy changes that would allow humanitarian organizations to import necessary equipment and materials, diplomatic pressure on governments that were restricting access to clean water for political reasons, and public education campaigns that would help international audiences understand the connection between water access and human rights that were being violated through policies that treated basic necessities as political tools rather than universal needs that should be protected regardless of political circumstances or military objectives that might motivate restrictions on civilian access to essential services. The immediate response that Ronaldo authorized involved emergency funding for water purification systems that could operate despite infrastructure limitations, mobile water treatment units that could be transported to areas where permanent facilities had been destroyed, and medical supplies for treating diseases caused by contaminated water. But more importantly, his foundation committed to long-term advocacy and support for water infrastructure reconstruction that would require sustained pressure on governments and international organizations that had the power to change policies, but had chosen to prioritize political considerations over humanitarian concerns that affected millions of people whose survival depended on access to clean water. The technical challenges that Dr. Mitchell described included not just the immediate problem of providing clean water to people who needed it urgently, but the longer-term issues of rebuilding infrastructure that had been systematically destroyed, training local personnel to maintain water treatment facilities, and establishing supply chains for replacement parts and chemicals that would be needed for ongoing operations once initial emergency assistance had provided temporary relief. And these challenges required coordination between multiple organizations and governments that had different priorities and political considerations that complicated humanitarian work in ways that seemed designed to prevent effective assistance rather than facilitating it. The advocacy component of Ronaldo's response involved using his platform to speak publicly about water access as a human rights issue that should not be subject to political manipulation. And his statements about Gaza water crisis generated international attention that helped pressure governments and organizations to address restrictions that were preventing humanitarian assistance from reaching people who needed it desperately, while also educating audiences who had been unaware of the scope and severity of the crisis that was affecting 2 million people, whose access to clean water had been systematically restricted for reasons that had nothing to do with legitimate security concerns and everything to do with collective punishment that violated international law and basic human decency. The partnership that developed between Ronaldo's foundation and water rights organizations resulted in comprehensive programs that addressed both immediate needs and long-term solutions, including emergency water delivery systems, infrastructure reconstruction projects, and advocacy campaigns that challenged policies restricting access to clean water for political reasons. And these programs demonstrated how celebrity influence could be combined with technical expertise to address complex humanitarian crises that required both immediate relief and systematic changes in policies that created conditions where basic necessities like clean water were treated as political weapons rather than fundamental human rights that should be protected regardless of political circumstances or conflicts that affected the regions where people lived. The educational impact of Ronaldo's involvement in water crisis advocacy included increased public awareness of how water access could be used as a tool of oppression, better understanding of the connections between water rights and human dignity, and recognition that seemingly technical issues like water infrastructure were actually political and moral questions that required clear positions from people with influence and platforms that could generate pressure for policy changes that would protect civilian populations from collective punishment that violated international law and humanitarian principles that were supposed to govern behavior during conflicts that affected civilian populations. Years later, when emergency water projects had provided clean drinking water to hundreds of thousands of people in Gaza, when infrastructure reconstruction had restored some of the water treatment capacity that had been systematically destroyed, when international pressure had forced some policy changes that reduced restrictions on humanitarian assistance, Mitchell would reflect that Ronaldo's decision to learn about and advocate for Gaza water rights had been crucial for generating the political support and financial resources needed to address a crisis that had been largely ignored by international media and governments that preferred to avoid topics that might complicate their relationships with allies whose policies were creating humanitarian emergencies that violated basic principles about civilian protection and access to necessities required for survival, regardless of political disputes that motivated restrictions on essential services like clean water that should have been guaranteed under international law that was supposed to protect civilian populations during conflicts that affected their access to basic necessities.